So again, welcome to everyone on behalf of myself, Dr. Lisa Cooper, the entire team here at the Johns Hopkins Center for Health Equity, as well as our Community Advisory Board co-chair, Reverend Deborah Hickman. We have a very diverse group of participants today that includes patients, community members, health professionals, health system leaders, researchers. We have trainees, we have staff members, we have funders and payers from insurance companies. We also have representatives from a variety of different community organizations. So thank you all again. So we're going to go ahead now and talk about the Rich Life Project, which Rich Life stands for Reducing Inequities in Care of Hypertension, Lifestyle Improvement for Everyone. And it's led by myself and Dr. Jill Marceller as co-PIs and funded by the Patient-Centered Outcomes Research Institute, as well as the National Heart, Lung, and Blood Institute. We randomly assigned practices to one of two groups, the Standard of Care Plus or the Collaborative Care Stepped Care group. We also had staff members at the second group of clinics who got some more in-depth training. So as with any large-scale and pragmatic research study or program, we encountered some challenges in implementing this program, and specifically the collaborative care and stepped care approaches. Say that, this work has been done only through the hard work and dedication of a very large multidisciplinary team with a lot of strengths. And I just want to acknowledge the support of all of you that are mentioned on this slide. We have an amazing team. I also want to acknowledge the commitment and hard work of our health system partners. And then finally, but last but not least, next slide, our dedicated community advisory board members, including members and leaders of several local and national organizations, many represented on this slide. We've come a long way from our first town hall meeting in 2016. These are pictures from that meeting and also from some of the trainings of our care managers and community health workers, and also from our community advisory board retreat in 2018. And it's been a wonderful journey so far, and we look forward to continuing it with you. So without further ado, I think we'll turn over to Dr. Ibe and the panel.
So again, my name is Chidima Ibe, and thanks for introducing me, Dr. Cooper. For those of you who don't know me, I'm an assistant professor in the School of Medicine, and I've had the pleasure of being a part of the Rich Life study team almost since the project's inception. So it's really wonderful to have this opportunity to join all of you in this town hall meeting and be able to highlight the work that we've done over the past few years. I'd like to introduce our panelists before we start with this discussion. Ms. Willie McNair, who yes, there she is, hello, participated in the Rich Life Project at Park West Medical Center and has lived in Baltimore for most of her life. She currently resides in Mount Washington and is a recent retiree of the Baltimore City Public School System, where she served for 30 years as a paraprofessional. So we welcome you, Ms. McNair. We also have Ms. Sherry Perkins, who is a Rich Life care manager. Sherry has been a nurse at Chop Tank Health Center for 20 years, 5 of which has been spent as a care manager. She's held positions as a risk manager, an employee health nurse, and a staff nurse, as well as in-service education and infection control. And we're so lucky to have you here as part of our panel. We're also really fortunate to have Ms. Helen Awanda, who is a community health worker, a seasoned community health worker. She's been a community health worker for 10 years and has worked at Total Health Care for 7 of those years, really helping patients at Total Health Care address pressing social determinants of health. And we're really glad that she is also a part of this panel. So for Sherry and Helen, you are both at different health systems with very different populations. Sherry at Chop Tank in the Eastern Shore, which is more rural, and Helen here in Baltimore City, of course, a more urban environment. What was your involvement in the collaborative care team like, and how did it differ, or how is it similar to your previous work?
But definitely being involved in the Rich Life project, that really gave us permission to really focus on building or strengthening, that one-to-one relationship with the patient, and really tying the patient into being the leader of the treatment team. I've certainly been a nurse long enough where it was always the doctor that was the leader of the treatment team, and this is obviously, and I know the data supports this, having the patient be at the helm of that ship and saying what's important to them and what goals they want to work on, as well as assessing their healthcare literacy, which was something that we often didn't do before, is really helpful, and it's something that we definitely are going to continue, just because it not only feels good, it works well.
Being able to personally know many of the team members in place at Total Healthcare helped me to be able to assist the Rich Life Study patients here at Total Healthcare. So it was like that. And then the thing that wasn't that I wasn't familiar with was the training and the education to be able to for the patients to be able to utilize the home blood pressure monitors. I know that was a considerable game changer for a lot of the patients, just to have that education piece, and also to be able to gain an insight into understanding why their pressures were high or uncontrolled, and to be able to put them at the forefront of their own health management.
I just wanted to ask you about your experience in the Rich Life Project, since you were a patient at Park West, or you are a patient at Park West, and you worked with one of our care managers, Minnie, and the community health worker, Kenya. What was it like working with them?
Excellent.
Great.
It was good.
What made it excellent and good?
Meaning that my sugar was bad, my pressure was high, and when I got with them guys, it was better. But first of all, they gave me a blood cup to take my blood pressure, because I hadn't had one. So that helped me, and they gave me paperwork to keep my pressure down and my sugar down. They constantly called me all the time to see what else they could do to help me. And they helped me.
We only have 1 minute left, so for this portion, but I just want to sincerely thank all of the panelists for sharing your insights, your wisdom, and experiences with all of us.